Cold doctor dismisses worried single dad unaware he's the hospital's secret savior. The waiting room went completely silent when Dr. Vanessa Kirkland's voice cut through the air, sharp and dismissive. "Sir, I've been doing this for 15 years. I think I know a panic attack when I see one. Your daughter is fine. Please, take a seat and let us handle patients who are actually in crisis." Ray Coleman stood at the nurse's station, his hands trembling slightly, not from fear but from the effort of staying calm. His 8-year-old daughter, Zoe, sat behind him in a wheelchair, her lips faintly tinged blue, her breathing shallow and quick. He'd been trying to explain, for the third time, that this wasn't anxiety. This was something else. Something he recognized. "I need you to order a cardiac workup," Ray said quietly. "Now. Not in 20 minutes. Now." Dr. Kirkland let out a short, humorless laugh and turned to the nurse beside her. "We've got a father here diagnosing his own daughter," she said, not bothering to lower her voice. "Must be nice having a medical degree from Google." A few people in the waiting room chuckled awkwardly. Ray didn't. He looked down at Zoe, whose eyes were starting to flutter, and something in his expression shifted, the quiet patience draining out of his face, replaced by something colder, sharper, more certain. "Dr. Kirkland," Ray said, his voice suddenly carrying an authority that made the nurse beside her go still. "I'm going to say this one more time. If you don't order that workup in the next 60 seconds, I'm invoking Article 12 of this hospital's emergency review protocol." Dr. Kirkland blinked. "Excuse me? Article what?" Ray didn't answer. He simply pulled out his phone, pressed a single contact, and said 4 words that would change everything in that hallway. "This is founder access. Emergency." 3 weeks earlier, nobody at Ridgeview Memorial Hospital had any idea who Ray Coleman really was. To the nurses on the 3rd floor, he was just a regular dad, quiet, polite, always a little tired looking, the kind of man who said thank you to everyone from the janitor to the billing clerk. He drove a 10-year-old pickup truck with a dent in the back bumper he'd never bothered to fix. He wore the same faded flannel jacket most days, and his boots had the kind of wear that came from actual work, not fashion. Nobody looked twice at him. That was exactly how he wanted it. Ray was 44 years old, and he was raising Zoe alone, ever since his wife, Danielle, had passed away 2 years earlier from complications during a routine surgery, a surgery that, in Ray's professional opinion, should never have gone wrong the way it did. That loss had reshaped his entire life, in ways nobody at Ridgeview Memorial could have guessed just by looking at him. Because what none of them knew was that Ray Coleman wasn't just some quiet single dad who happened to bring his daughter in for regular checkups. Ray had spent the first 15 years of his career as a trauma surgeon, one of the most respected in the state, before an injury to his own hand ended his ability to operate. After that, instead of leaving medicine behind entirely, he'd pivoted into something few people understood: hospital systems investment and reform. Using the settlement money from his wife's case and a substantial inheritance from his own father, Ray had quietly become the majority private stakeholder in 3 regional hospitals, including Ridgeview Memorial, through a holding entity that kept his name completely out of public records. He didn't do it for power. He did it because after watching Danielle die from what he believed was a preventable error, he wanted to understand, from every possible angle, how hospitals actually failed patients. Not from a boardroom. Not from spreadsheets. From the waiting room. From the exam table. From the perspective of a worried parent nobody bothered to really listen to. So for the past 8 months, Ray had been doing something almost nobody in his position would ever do. He'd been quietly bringing Zoe in for her routine appointments, sitting in the same waiting rooms as every other anxious parent, watching how the staff treated people who didn't have money, connections, or confidence. He watched who got listened to. He watched who got dismissed. And slowly, methodically, he'd been building a picture of exactly where Ridgeview Memorial was failing the people who needed it most. What he hadn't expected was that the person who would fail his own daughter the most spectacularly would be the hospital's own head of pediatric emergency medicine. Dr. Vanessa Kirkland was 51 years old, sharp-featured, always immaculately put together, with the kind of confidence that came from being the smartest person in nearly every room she'd ever walked into. She'd graduated top of her class, published extensively, and had built a reputation as one of the most efficient physicians on staff. Efficiency, to Dr. Kirkland, meant triage speed. It meant not wasting time on parents who, in her professional experience, tended to catastrophize every fever and every stomachache into an emergency. She wasn't cruel in a cartoonish way. She genuinely believed she was good at her job. But somewhere along the way, competence had curdled into arrogance, and arrogance had curdled into something closer to contempt, a quiet, practiced dismissiveness toward anyone she'd already decided wasn't worth her full attention. And within about 30 seconds of meeting Ray Coleman 8 months earlier, she had decided exactly that. Another anxious parent, she'd said to a colleague, just loud enough for Ray to hear, after their very first visit together. "You can always tell. They come in with a list of symptoms they read online and act like they went to medical school." Ray hadn't corrected her. He'd simply nodded, thanked the nurse, and taken Zoe home. That had become the pattern for 8 months. Small dismissals. Rushed explanations. A general sense that his concerns, however calmly and precisely stated, mattered less than they should. Zoe had a heart condition, a mild but real arrhythmia that required monitoring, something Ray understood better than almost anyone in that hospital, given his own background. It wasn't life-threatening under normal circumstances, but it needed to be taken seriously, especially when her symptoms changed. And over the past few months, they had been changing. The stakes, for Ray, were about as high as they could get. This wasn't about ego or being right. This was about his daughter's heart, quite literally, and about a system he had personally invested in to make sure it protected kids like her, a system that, so far, had failed to live up to what he'd hoped it would become. The first real incident happened on a Tuesday afternoon, during a routine follow-up appointment. "Her episodes are lasting longer," Ray explained calmly to Dr. Kirkland, sitting in the small exam room while Zoe swung her legs off the edge of the table, humming quietly to herself. "They used to be maybe 10, 15 seconds. The last one lasted almost a full minute. I timed it." Dr. Kirkland glanced at her tablet, barely looking up. "Kids get worked up. Especially anxious kids. Have you considered that maybe some of this is behavioral?" "She has a diagnosed arrhythmia," Ray said evenly. "I'm not asking you to speculate. I'm asking you to review the data I'm giving you." "I've reviewed plenty of parent-reported data over the years," Dr. Kirkland said, finally looking at him with a thin, patient smile that didn't reach her eyes. "It's rarely as precise as parents think it is. I'll note your concerns in the chart. We'll continue monitoring at the standard interval." "The standard interval is 6 months, Ray said. I'm telling you her symptoms have escalated in the last 6 weeks. And I'm telling you," Dr. Kirkland said, her tone edging toward impatience, "that I have 20 other patients today, several of whom have far more urgent issues than a stable arrhythmia that's being appropriately monitored." "I understand you're worried. Parents always are. But worry isn't the same as medical necessity." Ray sat with that for a moment, jaw tight, saying nothing further. He picked Zoe up off the table, thanked the nurse on the way out, and left. He didn't argue. He didn't escalate. Not yet. But he made a note, mentally, the way he'd made a dozen other notes over the past several months. The second incident happened 3 weeks later, in the hospital's general waiting area, and this time, Ray wasn't the only person on the receiving end of Dr. Kirkland's particular brand of dismissiveness. There was an elderly woman named Louise sitting near the check-in desk, accompanied by her granddaughter, a soft-spoken teenager named Amara who worked part-time as an aide on the hospital's cleaning staff to help cover Louise's medications. Louise had been having chest pains on and off for weeks, and Amara had finally convinced her to come in, taking time off her shift to bring her. Ray happened to be sitting nearby, waiting for Zoe's name to be called, when he watched Dr. Kirkland walk past the two of them without so much as a glance, speaking instead to a nurse. "Is the woman in Bay 4 still waiting on labs? I told her 20 minutes, not 40. "Dr. Kirkland," Amara said gently, standing up, "Sorry, my grandma's been having chest pains, and the front desk said someone would look at her soon, but it's been almost 2 hours, we're triaging based on severity," Dr. Kirkland said, barely slowing her pace. "If it were urgent, she wouldn't still be sitting in a chair. I'll have someone get to her when we're able. She's 81, Amara said, her voice cracking slightly. She gets tired just walking to the bathroom some days. I don't think she'd tell you if it was really bad. She doesn't like being a bother. Dr. Kirkland paused, just for a moment, something almost like consideration crossing her face, and then it passed. I appreciate that, she said, in a tone that suggested she didn't particularly appreciate it at all, but I have to prioritize based on clinical presentation, not family concern. She'll be seen soon. She walked off. Amara sat back down next to her grandmother, blinking back tears, gently squeezing the old woman's hand. Louise patted her granddaughter's arm and murmured, "It's all right, sweetheart. I'm sure they know what they're doing." Ray watched the whole exchange without saying a word, but something in his chest tightened uncomfortably. He recognized that particular kind of exhaustion on Amara's face, the exhaustion of loving someone and not being believed when you try to advocate for them. He'd felt it himself, more than once, over the past several months. He got up quietly, walked to the check-in desk, and asked, in a calm, unassuming voice, whether Louise's chart could be flagged for expedited review, given her age and cardiac symptoms. The clerk looked at him strangely. "Are you a relative?" "No," Ray said. "Just someone who thinks 81-year-olds with chest pain probably shouldn't wait 2 hours in a lobby chair." The clerk hesitated, then made a note. It wasn't much. But it was something. Later that day, when Louise was finally seen, it turned out she had a partially blocked artery that required immediate intervention. She was stable, in the end, thanks largely to Amara's persistence and, in small part, to a quiet nudge from a stranger in the waiting room. But the wait itself had been unnecessary, and everyone who'd witnessed it knew it. The third incident, and the one that really began pulling threads together for the handful of staff members paying attention, happened during a hospital-wide meeting about departmental budgets, of all places. Ray wasn't supposed to be there, at least, not as Ray Coleman, worried single dad. He attended under a different, more official capacity that only a handful of senior administrators recognized, sitting quietly near the back of the room, dressed slightly more formally than usual, introduced only as a representative from ownership oversight. Dr. Kirkland, seated near the front, didn't recognize him at all. Why would she? To her, he was just the anxious dad from Base 6 who thought WebMD made him a cardiologist. During the meeting, the hospital's CFO raised concerns about pediatric emergency wait times and a rising number of formal complaints filed against certain physicians, though names weren't mentioned. Dr. Kirkland, sitting near the front, scoffed audibly. "With respect," she said, "half these complaints come from parents who don't understand triage protocol. We can't run a hospital based on hurt feelings. If anything, our efficiency numbers should be commended, not scrutinized." A younger resident sitting beside her, a nervous woman named Dr. Patel, shifted uncomfortably in her seat but said nothing. Ray noticed that too, the way people around Dr. Kirkland tended to go quiet, not because they agreed, but because disagreeing felt dangerous. Efficiency shouldn't come at the cost of actually listening to patients, the CFO said carefully. We've had at least 2 incidents this quarter where parent-reported symptoms were dismissed and later confirmed as legitimate medical concerns. Anecdotes, Dr. Kirkland said dismissively. Every department has anecdotes. You could build a case against any physician if you cherry-pick outliers. Ray, sitting quietly in the back, said nothing during the meeting. But he wrote something down in a small notebook he carried, the same notebook he'd been filling for months. He underlined it twice. The gut punch moment, the one that would stay with everyone who witnessed it, happened the following week, and it involved Amara again. Ray had come to recognize her by then, the soft-spoken young aide who moved through the hospital hallways with quiet efficiency, always polite, always a little tired around the eyes. He learned, through a passing conversation while waiting for Zoe's appointment, that Amara was 19, working full-time while attending community college part-time, trying to become a nurse herself one day, specifically because of how much her grandmother's illness had shown her what good, attentive care could mean. That week, Amara had made a small mistake. She'd left a supply cart momentarily unattended in a hallway while helping a disoriented patient find their room, and the cart had blocked part of a hallway just as Dr. Kirkland was rushing through with an actual emergency case. Dr. Kirkland, understandably stressed, snapped. "Move this out of the way," she barked, shoving the cart herself, sending supplies clattering to the floor. "This isn't a parking lot. If I have a patient crash because some aide left junk in the hallway, that's on you." "I'm so sorry," Amara said, dropping to her knees immediately to gather the scattered supplies, her hands shaking. "I was helping someone find their. I don't care what you were doing," Dr. Kirkland snapped, already walking away. "Do your job. Or don't do it at all." Amara knelt there in the hallway, gathering gauze and gloves off the floor, her eyes filling with tears she was clearly fighting to hold back. A couple of nurses walked past without stopping. Ray, who had been sitting in a nearby chair waiting for Zoe's name to be called, quietly got up, walked over, and knelt down to help her gather the supplies. "You don't have to do that," Amara said, sniffling, embarrassed. "I know," Ray said simply. "But it's faster with two people." They gathered everything in silence for a moment. Then Ray said, quietly, "She was wrong to talk to you like that. You know that, right? A cart in a hallway isn't a crisis. How she reacted to it, that's not about you." Amara wiped her eyes and gave a small, grateful smile. "You're the first person today who said something like that to me." "That's a shame," Ray said. "You're doing good work here. Don't let anyone convince you otherwise." He didn't say much else. But something about the moment settled deep in his chest, alongside everything else he'd witnessed over the past several months, the dismissed symptoms, the ignored chest pains, the casual cruelty dressed up as efficiency. He thought about Danielle, about how many times during her final hospital stay he'd wished someone, unknown, had simply knelt down and helped instead of walking past. That night, Ray sat at his kitchen table after Zoe had gone to bed, and he opened his laptop. He pulled up a file he'd been keeping quietly updated for months, labeled simply Ridgeview Pediatric ER Review. He added Amara's name to a list of staff members who'd shown genuine compassion under difficult conditions, a list he intended to make sure got noticed, eventually. Then he added another entry, longer this time, detailing the pattern of dismissed patient concerns tied specifically to Dr. Vanessa Kirkland. He closed the laptop, sat in the quiet kitchen for a long moment, and made a decision he'd been circling for weeks. He decided it was time to stop watching from the sidelines. The final incident, the one that led directly to the hallway confrontation from the opening of the story, happened 3 days later, on a Thursday evening, when Zoe's symptoms escalated dramatically during dinner. She'd been eating quietly at the table when she suddenly went pale, her breathing turning quick and shallow, her lips taking on a faint bluish tint that Ray recognized immediately, with the kind of clarity that came from 15 years of trauma medicine layered over 2 years of watching his daughter's condition like a hawk. He didn't panic. He moved fast, calm and controlled, buckling Zoe into the car and driving straight to Ridgeview Memorial's emergency entrance, calling ahead to alert them. When they arrived, Zoe was placed in a wheelchair, and Ray wheeled her directly to the nurse's station, explaining clearly and precisely what was happening: the rapid heartbeat, the shallow breathing, the color change, the duration compared to her baseline episodes. A nurse began to move quickly, recognizing the urgency, but before anything could be ordered, Dr. Kirkland arrived on the floor, glancing at the chart, glancing at Zoe, and glancing at Ray with an expression of weary, practiced patience. "Mr. Coleman," she said, not unkindly exactly, but with the tired condescension of someone who had already made up her mind. "I understand you're worried. But her vitals on intake don't show anything acute. I've reviewed her history. This looks like a panic response, possibly triggered by anxiety around her cardiac diagnosis. It happens more than people realize, especially in children who've had a health scare. She's had this condition for 2 years," Ray said, keeping his voice level despite the tightness in his chest. "I know what her panic attacks look like. This isn't that. Her lips are turning blue, Dr. Kirkland. I need you to order a cardiac workup right now." "Sir, I've been doing this for 15 years, Dr. Kirkland said, her patience visibly thinning. "I think I know a panic attack when I see one. Your daughter is fine. Please, take a seat and let us handle patients who are actually in crisis." That was the moment. The waiting room went quiet. Ray looked down at Zoe, whose eyes were starting to flutter, her small chest rising and falling too fast, and something in him shifted from restraint to resolve. "Dr. Kirkland," he said, his voice suddenly carrying a different kind of authority, one that made the nurse beside her go completely still. "I'm going to say this one more time. If you don't order that workup in the next 60 seconds, I'm invoking Article 12 of this hospital's emergency review protocol." Dr. Kirkland blinked, genuinely thrown. "Excuse me? Article what?" Ray didn't answer her directly. He pulled out his phone, pressed a single saved contact, and spoke 4 words that would change the trajectory of the next hour entirely. "This is founder access. Emergency." Within 90 seconds, the entire dynamic of the emergency department shifted. A senior charge nurse, who had clearly heard those exact words before during some prior briefing, went pale and immediately began paging the on-call cardiologist directly, bypassing standard triage. 2 more staff members appeared almost instantly, moving with a speed and urgency that hadn't existed 30 seconds earlier. Dr. Kirkland stood frozen, phone words still hanging in the air, utterly confused. "What is going on?" she demanded, looking between the suddenly frantic staff and Ray, who remained perfectly calm, kneeling beside Zoe's wheelchair, holding her hand. "You'll understand shortly," Ray said quietly, not looking up from his daughter. Within minutes, Zoe was in an exam room, hooked up to monitors, and the cardiac workup Ray had been requesting revealed exactly what he'd feared: a dangerous arrhythmic episode requiring immediate intervention, one that, left untreated for even another 20 or 30 minutes, could have become genuinely life-threatening. A cardiologist, paged directly through emergency protocol, arrived within 10 minutes and began treatment immediately. Dr. Kirkland stood outside the exam room, arms crossed, trying to process what had just happened, when the hospital's chief administrator, Dr. Okafor, arrived on the floor looking distinctly uneasy. "Vanessa," Dr. Okafor said quietly, pulling her aside. "Do you know who that is?" "Some overprotective father who apparently has a direct line to God, apparently," Dr. Kirkland said, still irritated, still not understanding. "That's Raymond Coleman," Dr. Okafor said, lowering his voice further. "He owns 62% of Ridgeview Memorial through Coleman Family Holdings. He's been the majority private stakeholder for the last 3 years. Vanessa, he sits on the board. He's the reason this hospital got its new cardiac wing funded 18 months ago." Dr. Kirkland's face went through several stages in rapid succession: confusion, disbelief, and finally something close to genuine dread. "That's not possible," she said weakly. He brings his daughter in for regular checkups. He's just a father who happened to have watched, for 8 months, exactly how this hospital treats families who don't have his kind of power," Dr. Okafor said. "And from what I understand, he's documented quite a lot." Zoe stabilized within the hour. The cardiologist confirmed that the intervention had come at exactly the right moment. Any longer delay, and the outcome could have been drastically different. Ray sat beside her hospital bed for the rest of the evening, holding her hand while she slept off the sedation, his own exhaustion finally catching up to him now that the immediate danger had passed. The next morning, a formal meeting was called in the hospital's main conference room, attended by the board, senior administration, and Dr. Kirkland herself, who arrived looking considerably less composed than usual. Ray walked in wearing a simple gray sweater, not a suit, carrying the same worn leather folder he always brought to Zoe's appointments, except this time, everyone in the room understood exactly who he was. "I want to be clear about something before we begin," Ray said, taking a seat, not at the head of the table, but in a regular chair, same as always. "This isn't about revenge. This is about accountability, and there's an important difference." He looked directly at Dr. Kirkland. 8 months ago, I started bringing my daughter here not just because this is a good hospital in a lot of ways, but because I wanted to understand, firsthand, where it wasn't good enough. I didn't tell anyone who I was because I wanted to see this place the way an ordinary parent sees it. And Dr. Kirkland, in 8 months, you dismissed my concerns about my daughter's condition on at least 4 separate occasions that I documented directly. You dismissed an 81-year-old woman's chest pain for 2 hours because her granddaughter wasn't clinically qualified to advocate for her. And I personally watched you humiliate a 19-year-old aide in a hallway over a supply cart, then walk away without a second thought. Dr. Kirkland's face had gone pale. I have always prioritized patient care. My record speaks for itself. My outcomes are. Your outcomes are good when you actually listen, Ray said, not unkindly, but firmly. The problem isn't your competence, Dr. Kirkland. It's that somewhere along the way, you stopped believing that the people in front of you, parents, grandchildren, teenage aides, might actually know something worth hearing. You stopped listening because you decided, a long time ago, that you already knew everything you needed to know. The room was silent. Dr. Kirkland said nothing, her jaw tight, her hands folded rigidly in her lap. I'm not asking for your resignation, Ray continued, and a flicker of surprise crossed several faces around the table, including Dr. Kirkland's own. I've reviewed your clinical record beyond the incidents I witnessed personally. You are, by most measures, an excellent physician when you're actually engaged. What I am requiring is a formal, monitored probationary period, 6 months, mandatory retraining specifically on patient communication and family advocacy protocols, and a direct review of every dismissed pediatric case from the last year, conducted by an outside auditor. If, at the end of 6 months, the pattern continues, then we'll have a very different conversation. Dr. Kirkland swallowed hard. And if I do everything you're asking? Then you keep your position, Ray said simply. Because the goal here was never to destroy your career. The goal was always to fix what's broken. Firing you doesn't fix the culture that let this happen for years before I ever walked through those doors. But if you're willing to actually change, I'd rather you become part of the solution than just another cautionary tale. Dr. Kirkland nodded slowly, something in her rigid posture finally loosening, just slightly. That's more grace than I expected, she admitted quietly. Ask my daughter's cardiologist how close we came yesterday, Ray said, his voice steady but with an edge underneath it. Then decide how much grace you think you deserve. But I meant what I said. I'd rather build something better than just tear something down. Over the following weeks, changes moved quickly through Ridgeview Memorial. Amara, the young aide, was called into a meeting she assumed was about the supply cart incident, bracing herself for discipline. Instead, she was offered a fully funded scholarship through a new hospital initiative quietly established by Ray, specifically designed to support staff pursuing nursing degrees while working. Louise, the elderly woman with the blocked artery, received a personal follow-up call from hospital administration along with a formal review of wait time protocols for elderly cardiac patients, changes that would go on to affect hundreds of future patients. Dr. Kirkland completed her retraining with what colleagues described as genuine effort, not just compliance. 6 months later, in a follow-up review, Dr. Patel, the nervous resident who had once gone quiet in meetings rather than disagree, mentioned that Dr. Kirkland had actually stopped her mid-sentence during a case discussion to ask, wait, what did the mother say her daughter's symptoms actually felt like? Let's start there. It wasn't a dramatic transformation. But it was real. Ray never told most of the staff at Ridgeview who he really was, beyond what had already come out during the incident. He continued bringing Zoe in for her regular appointments, still wearing his faded flannel jacket, still driving the same dented pickup truck. Most new employees who joined the hospital in the months afterward had no idea that the quiet, tired-looking dad in the waiting room owned a majority stake in the building they worked in every day. One evening, several months after everything had settled, Amara found Ray in the hospital cafeteria, sitting alone with Zoe, who was now fully recovered and swinging her legs happily while eating a bowl of ice cream that had clearly been a reward for a very boring checkup. I never got the chance to properly thank you, Amara said, sitting down across from him. For that day in the hallway. And for everything since. You don't need to thank me, Ray said. You earned that scholarship because of who you are, not because of who I am. Still, Amara said. You didn't have to notice me. Most people don't. Ray glanced at Zoe, who was now happily explaining to no one in particular why chocolate ice cream was scientifically superior to vanilla, then back at Amara. I spent a long time being someone nobody noticed either, he said quietly. Not because I couldn't have been noticed. Because I chose to be quiet for a while, after I lost my wife. It gave me a strange kind of clarity, being invisible for a bit. You see things differently when people don't think you matter enough to perform for. He paused. I don't ever want to forget what that felt like. That's the only reason any of this worked. Not because I have money. Because I remembered what it was like not to be believed. Amara smiled, something warm and genuine crossing her face. For what it's worth, I believe you'd have noticed me even if you didn't own half the hospital. Probably, Ray said, smiling back. Though it does help speed things up when you need a cardiac workup in under a minute. That night, driving home with Zoe asleep in the back seat, ice cream stains still on her shirt, Ray thought about Danielle, the way he often did on quiet drives like this one. He thought about how much of what he'd built over the past 3 years had come from grief, from wanting to make sure no other family sat in a waiting room feeling as unheard as he once had. He thought about Dr. Kirkland, and how justice, done right, wasn't always about punishment. Sometimes it was about giving people a real, honest chance to become someone better than the pattern they'd fallen into. He glanced in the rearview mirror at his sleeping daughter, safe, breathing steady, her color back to normal. And he thought, not for the first time, that the most powerful thing he'd ever done in that hospital wasn't buying a stake in it. It was simply refusing to stop believing his daughter, even when the whole room told him he was wrong. Being dismissed, Ray had learned, said far more about the person doing the dismissing than it ever did about the person being dismissed, and sometimes, the quietest voice in the room is the one carrying the most weight of all.